Hello, my name is Brady Smith. I'm a registered nurse and the trauma coordinator at Wickenburg Community Hospital. I've worked here for about 35 years this month. It's been a pleasure and an honor to care for the people of Wickenburg and the surrounding area. A lot of you don't know, about 3 years ago we became a level 4 trauma center. Part of our program is public education, particularly safety. Today we're going to take a look at ground level falls and seeing if we can prevent some of those. I see about 3 a day in the emergency room, so I'm wondering if we can't cut some of that down. Now, one of the basics is exercise. If you don't use it, you lose it. We all, no matter where we're at, stuck in a chair or whatever, need to get with our providers and get some sort of exercise or activity program set up. Hang on to what you have, improve if you can, but get with your provider and see if you can't set something like that up. I'm going to move into one of the reasons I see falls, and it's dizziness and lightheadedness. What I would like to tell you about something like that, if it would ever occur to you, is get to the ground. Don't try to make it to the chair, don't try to make it to the curb, go down. That kind of leads us into another one I see in the emergency room, and it's the position change. Oftentimes the patient says, I got up out of bed and I fainted. I wonder if he or she had sat up first and sat for a second, if this would have happened at all. Something to think about. But I can tell you in Arizona, there's a good chance that dehydration is really what the problem was. Almost none of us are properly hydrated. I see people with their bottle all the time, and that's fantastic. Try to keep the fluids going all day long. For the sports drinks and the energy drinks, I really want you to run those by your provider before you do that. Speaking of your provider, let's go over your medication list the next time you're in. Many medications have dizziness as a side effect. Wouldn't it be nice to reduce a dose or even eliminate medication? Another thing, guys, let's get our eyes checked. Let's not trip over something because we didn't see it. That leads us to a safe home. A safe home. Got to start this with 8 in 10 falls in the home occur in the bathroom. 8 in 10. So listen, let's get the safety bars in there. Let's get the towels picked up, the throw rugs gone, the extension cords across the walkway, even a dog leash. And you go, dog leash? I cannot tell you over the years how many people I have seen who tripped walking their dog when the lead got caught, bad enough to come to the emergency room. So it's something to think about. Another thing I have at my house is a nightlight system, and it is throughout the whole house. They're real light pastels, and I do not need to turn a light switch on to walk anywhere in my house. Something to think about. Now, if I've bored you to tears, I want to leave you with this thought. As we age, our bone density lessens, we take blood thinners to prevent strokes, so when we do fall, we have a higher incidence of fractures and bleeding that I have trouble controlling. These falls can be devastating life changers for you and your family. We at Wickenburg Community Hospital care about your health and safety. Please see your doctor, review your meds, get an activity list, make a safe environment for you to live in, and be safe.